Hi, I'm Dan Pollybea. I'm a professor of medicine at the University of Colorado in the Department of Medicine and in the Division of Hematology. The next abstract is really exciting and has been long anticipated. It was presented by Dr. Mark Levis from Johns Hopkins on behalf of the Blood and Marrow Transplant Clinical Trials Network. So this is a large international cooperative group study. And what the investigators did here was study whether the addition of the FLT3 inhibitor gilteritinib after an allo transplant for AML patients who had a FLT3 mutation would allow for benefit. So this has long been assumed or presumed that maintenance therapy with a FLT3 inhibitor would allow for benefit. And there's been suggestions of this with other FLT3 inhibitors like sorafenib recently reported. But gilteritinib is a much more specific FLT3 inhibitor. And so this was a very promising study design. It was a randomized, blinded phase 3 study in which patients post-transplant after engraftment were given a placebo or gilteritinib. And at first blush, when they presented the data, overall, the primary objective was relapse-free survival. And there was close to, but not under significant statistical significance. So at first blush, it looked to be close, but maybe a little bit disappointing. However, one of the predefined subgroups that they said they were going to look at were patients with and without MRD or measurable residual disease going into the transplant. And when they looked at these different subgroups, it was quite striking. So the patients who had MRD going into the transplant definitely derived benefit from post-transplant gilteritinib maintenance. And contrast that with the MRD negative patients, they did not derive benefit from this intervention. So it seems pretty clear that the takeaway from this study is that gilteritinib maintenance is important and does prolong relapse-free survival in patients who are MRD positive going into their transplant. And the MRD test they used was a PCR-based test for the FLT3 mutation. So unclear whether you can expand the definition of MRD beyond that. But at least for now, I think there's a very clear indication or group of patients that do benefit from this intervention, and probably the first of many such therapies that we're going to be seeing tested in the post-transplant maintenance setting.